Ladies and gentlemen, please rise and join singer Kate Lamb and us faculty as we sing our national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Please be seated. The sun, the moon, the stars, and Minnesota weather have all aligned to bring you to this moment. The SPH graduating classes of 2019. I also want to welcome those that are joining us via the live webcast of today's ceremony. Given the geographic diversity of our student body, I'm sure that many of our graduates have families and friends that are watching us literally from all over the world. Now, you can follow us on Twitter, and you can post congratulatory messages of your own by using the hashtag SPHgrad. That's caps on the SPH. And our faculty up here are invited to join the online congratulations and to help spread the news about this year's extraordinary graduating class from the School of Public Health. So, if you see our faculty working their mobile phones, we want you to assume that they aren't doing their email, nor are they playing Helix Jump or Subway Surfers, at least as far as you know. Every commencement ceremony that we have, and this is my 14th as dean, believe it or not, reminds us faculty why we chose a career in higher education. You, our students, came here for a professional and a scientific education to make the world a better place. And we have been honored for as long as you have been here to be your partners as you launch or grow your career. And today marks a milestone toward the future that you want for yourself, your family, and future generations. Since 1944, this school has been working diligently to give every person access to the right to a healthy life. And this year, we will award some 350 degrees and certificates to our students. For 75 years, we have prepared some of the most influential leaders in the field, and we've transformed the way that public health is practiced around the globe. And for the next 75 years and beyond, we will be proud to continue to play a part in shaping all the future generations of public health leaders. We have a terrific ceremony for you today, but before we begin, I want to acknowledge a few of those here on stage. Actually, I'm going to acknowledge everybody on stage, but maybe not by name. Representing the University of Minnesota Board of Regents, Regent Richard Beeson. Representing the University of Minnesota Office of the Executive Vice President and Provost, Karen Hansen. The School of Public Health Associate Dean for Learning Systems and Student Affairs, Professor Kristen Anderson. Our commencement speaker, Dr. Laura Magana, who I will introduce shortly. The president of the School of Public Health Alumni Society Board, Karen Wick, class of 1994. Yes, she was right here with you at one point. This year's University Mace Bearer, Dr. Jim Hart. And class of 2019 student speaker, Taiwo Aremu, a candidate for an MPH, a candidate for the MPH in Public Health Administration and Policy. Now, if you've looked at our website, you know that we have one of the most diverse group of academic faculty and disciplines in the university. Public health is that way. And our faculty and students come to us from all kinds of different backgrounds. I want to introduce the leaders of the current divisions in the School of Public Health. And I'll ask them to quickly raise their hand. Dr. Diane Newmark-Steiner, professor and head of our Division of Epidemiology and Community Health. And you will hear from her later as she introduces each one of you as you receive your degrees. Professor and head of the Division of Environmental Health Sciences, Bruce Alexander. Associate Professor and interim head of the Division of Biostatistics, Joe Koopmeiners. Professor and head of the Division of Health Policy and Management, Tim Beebe. And I'm going to ask everybody else on this stage to stand up because this is the faculty in all of our divisions in the School of Public Health. Please come, stand up. This group of faculty, it's just a huge privilege to be dean of this school with such talented people. They've been dedicated for a long time to equipping our students to respond to some of the most pressing public health needs today and in the future, including such things as climate change, newly emerging and re-emerging infectious diseases, our rapidly aging population worldwide, issues of health equity and social determinants of health, the changing economics of healthcare, and a deluge of digital data about health. Our faculty and our students are committed to having an immediate and long-lasting impact on our communities and our partners all over the world. Our Master of Public Health graduates will go on to shape public policy. They will develop evidence-based programs and outreach. They'll work in public health agencies, NGOs, healthcare, and myriad settings that want and need their amazing talents. Our Master of Science graduates have honed their skills in big data access, management, analytics, and they'll bring those skills as researchers to the world of public health. Graduates of our Master of Healthcare Administration program will serve in the changing landscape of healthcare and managed care as we move from fee-for-service to value-based care systems. And our PhD graduates will become the next generation of public health scientists in the public and in the private sector. And about half of them will go on to careers in each, the academy as well as in the private sector. Regardless of the degree, the education and experience of our students that they receive here makes them well-positioned to shape a healthier future. Our programs and our research have evolved in this school over the past 75 years to meet current needs and the needs of the future. Our focus and our determination will always be to protect and promote the health of all populations. Since its founding, the School of Public Health has made vital contributions to public health. We have been part of the movement to increase vaccination rates around the world. We have been involved in developing the first comprehensive definition of child abuse and neglect. We contributed to the landmark 1964 U.S. Surgeon General's report that concluded that smoking is detrimental to your health. And there are so many more. The public health in this state is improved in part because of the work that this school has done and the fact that so many of our graduates serve the needs of this very state. The future will hold astonishing advances in technology and many challenges in the future that we perhaps can't even imagine today. And yet, despite the unknowns, we have faith in every student graduate to seek and shape a healthier world. We're enormously proud to have played a role as your teachers, as your mentors, and as your advisors, and we hope that we have helped you develop the tools that will help you keep making a difference. It is my honor today to introduce our commencement speaker, Dr. Laura Magana. She is currently the president and CEO of the Association of Schools and Programs of Public Health, or as we know it, ASPPH. And prior to joining ASPPH, Dr. Magana dedicated more than 35 years to successfully leading the advancement of public and private universities in Mexico, educational organizations in the USA, United Nations programs, and NGOs in Central America and Europe. And she was most recently the Dean of the School of Public Health at the National Institute of Public Health in Cuernavaca. Under Dr. Magana's leadership, ASPPH has strengthened the capacity of all of its member institutions, like our own school, by advancing leadership, excellence, and collaboration for academic public health. We could not be more pleased to have her today as our commencement speaker. Please join me in giving a very warm, at least a 62-degree welcome to Dr. Laura Magana.
Good evening, and congratulations to the class of 2019. It is so great to be back on a campus. Before I became president of ASPPH, most of my career was spent in the university environment. And one of the things I miss most is the life of a school. Noisy, surrounded by students full of energy and joy. I spent 13 years commencements with my public health students, so thank you, Dean Finnegan, for letting me make that 14. I barely remember my own commencement, but I do remember well my graduate studies, and I remember how challenging they were. I started my PhD studies at the same time that my husband was starting his diplomatic career. My daughter Anna was 3 years old, and my daughter Jessica was 3 months old. I was working in the morning, part-time, attending classes most afternoons. arriving home late in the afternoon to take care of my girls. When they would sleep, I would study. So one time, Anna came to sit in my lap. I was underlining my psychology textbook, which had a lot of pictures. And Anna asked me, "Mommy, what are you doing? Why are you scratching your books?" So I told her, "I'm not scratching them. I'm underlining, Anna, so I can remember all the important things." The next day, Anna said, "Mom, I did your homework." I underlined the most important parts of your book so you can sleep earlier. So when I opened my textbook, guess what? All the pictures were scratched, of course. She was doing her best to help so I wouldn't have to stay up working. Graduate school is challenging, and the support of family and friends is key to our success. Now, probably your loved ones did not highlight your textbooks for you, but maybe they helped financially or emotionally. Even more importantly, they shape your values, which likely contributed to your decision to study public health. So let's recognize them. Their ongoing support as you start on your new careers will remain essential. Thank you, families, for being here with us. And graduates, what a wonderful accomplishment to arrive at this day. Maybe you work while getting your degree. Perhaps, like me, you were raising families while keeping up with your studies. Maybe you are in this city or even in this country alone. And look at you now. You're here. You made it. What an amazing class you are. I see you in front of me, almost like a mosaic. Different shapes and hues, but all forming one beautiful figure, the public health workforce of the future. In a few moments, all of you will be graduates of this incredible institution. And all of you have chosen to be part of the most noble profession. You have chosen public health, the art and science of preventing diseases, prolonging life, and promoting the health and well-being of people everywhere. Wow. I believe public health is a calling. Our profession is about caring. It's about giving. It takes being hands-on, building trust in communities. It means advocating for social justice, being the voice of the invisible, and not leaving anyone behind. This is radical, almost unthinkable in our modern, individualistic, and often selfish society. Already you have felt this calling in your time in the Twin Cities. When you connected Minnesotans living in food swamps to farmers markets, you didn't do that because it was prestigious or paid well. You were making sure not to leave anyone behind. When you studied how Minnesotans' jails provide health care for pregnant women who have abused opioids, you were being a voice for the invisible. And because of the dedicated men and women before us who have made public health their calling, just think about how many people now live healthier and happier lives. 75 years ago, when this school was first established, the average boy born in the US could expect to live a little over 63 years. Today, it's over 77. Back then, smallpox killed hundreds of millions. Polio paralyzed thousands. Today, both are almost entirely eradicated. And as you know, the story of public health in America is in many ways the story of this great school. As far back as 1869, this university's first president, Dr. William Watts, envisioned a time, and I quote, when a Department of Public Health will be established in all universities. I close the quote. A few years later, the University of Minnesota was one of the founding groups of the American Public Health Association. In many ways, as Dean Finnegan has written, the University of Minnesota is the national birthplace of academic public health. And through the years, this school has been instrumental in advancing the public health agenda. It was faculty of the University of Minnesota that helped show that smoking was a major cause of heart disease and helped pass the first citywide ban on cigarette vending machines. It was the University of Minnesota that advanced requiring all new buildings be fully accessible to people with disabilities. Years before Will Smith brought chronic traumatic encephalopathy, CTE, to the big screen, it was faculty of the University of Minnesota that first linked youth football to high rates of concussion. And right now, this school is leading a zero-tolerance movement to sexual harassment and discrimination that will transform our culture. For 75 years, you have been pioneers in public health, asking probing questions, encouraging innovation, advocating for society's most vulnerable populations. That is the proud legacy that you are part of, and now you are prepared to advance. And that is the pioneering spirit we need now more than ever. Because if you look around us, as much progress as we have made, it is obvious that we face daunting challenges. It seems like every day the news brings apocalyptic developments and dystopian predictions. This year, the Pulitzer Prize was awarded to 3 different newspapers for their coverage of 3 different mass shootings. In the last 10 years, deaths from alcohol, drugs, and suicide have more than doubled. Just in this period, in these 10 years, over 1 million Americans have died just from these very 3 preventable causes. We are confronting the existential challenges of climate change, and experts like Michael Osterholm warn us about the perils of a potential pandemic. These challenges are only exacerbated by growing social inequalities that dramatically affect the health conditions. So we see this gap between the countries. If you're a child in Angola, your chances of dying before age 5 are 90 times higher than if your child is of a child in Finland. We also see this gap within countries. In Washington, D.C., where I now live, you can get on the metro in Montgomery County, ride to Southeast D.C., and in 15 metro stops, the average life expectancy will drop 7 years. Now, there are just 2 ways to approach these concerns. We can panic, become paralyzed. We can isolate ourselves in bunkers or even build walls. Or we can choose to believe that this generation, your generation, is smart enough, bold enough, concerned enough for humanity that we can defy the predictions and build a better world. My choice? I'm betting on you. I believe I'm looking at the leaders, researchers, practitioners, advocates, and policymakers that will heal our broken world. The last 75 years of public health saw huge progress, but unfortunately, these advances have been distributed unevenly. I believe the challenge of the next 75 years will be to make sure that everyone has access to better health outcomes. It's our responsibility to work for more just and equal access to the conditions that make us healthy in the first place. As Pastor Charles Swindoll said, we are all faced with a series of great opportunities, brilliantly disguised as impossible situations. So, class of 2019, you have work to do. And as you prepare to take on those great opportunities, disguised as impossible situations, allow me to offer just 3 lessons from my own life, because it would not be a commencement address without some advice, right? So, lesson 1, make a way out of no way. Don't take no as a response. Do what is right. Stand for what you believe. Many times in your careers, you will run into obstacles, layers of bureaucracy, outdated societal expectations, skeptical colleagues. You need to persist. You need to forge the way. In 2004, I was hired as Dean of the School of Public Health of Mexico at the National Institute of Public Health. No woman had held the position. Nobody who wasn't a physician had the position. But I was determined. I had the passion and the educational background to transform the School of Public Health of Mexico into one of the leading institutions in Latin America. As part of my initial plans to restructure the school, I wanted the international accreditation. So for that reason, I approached CIF, the Council on Education for Public Health, to start the process. Well, I discovered it would be a very short process because they didn't accredit schools outside the United States. So I said, public health is global health. Why shouldn't CIF accredit international institutions? At that time, there were already visionary ASPPH leaders like Dean Finnegan that were pushing from within to welcome international members. So I just kept pushing and addressing the old guard's concern. I knew that while CIF accreditation would benefit my school, I also knew that our inclusion would also benefit CIF and existing accredited institutions. So eventually, because we didn't give up, CIF and ASPPH changed their outlook and criteria. My School of Public Health, the INSP, became the first CIF-accredited public health school outside the United States. Only 12 years later, I was offered the privilege and honor to lead ASPPH, the first woman and the first senior leader from an international member to hold the position. Dean Finnegan was a leader in the internationalization effort, but 12 years ago, I don't think either of us thought I would be standing here today. My career trajectory has shown me that you should never underestimate your ability and persistence to transform the status quo. The changes might take time, but it is with small actions that we eventually change the larger reality. Keep in mind the words of Dr. Martin Luther King Jr. The ultimate measure of a person is not where he or she stands in moments of comfort and convenience, but where he or she stands at times of challenge and controversy. So we are not called to conform to this world. We are called to transform and shape our own future. So don't let anything stand in your way. Lesson 2, think globally and act locally. I know it's counterintuitive. During my professional and diplomatic career, I have lived in 4 countries on 3 continents. I have proudly worked all my life to make all the organizations that I have worked with more international. And here I am telling you to focus first on your own backyard. I strongly believe that you need to start with your own communities. I remember some years ago I was living in Michigan working with a Hispanic population who happened to have the highest high school dropout rate here in the States. I lived in West Bloomfield, which is still a affluent suburb, and the students I worked with lived in Pontiac, a very deprived community. And one Sunday at our church, the pastor told me that several teenagers at the church wanted to go overseas. They were from wealthy and middle-class families, and they wanted to do something to improve communities in developing countries. They were talking about going to Guatemala or even as far as Africa. So I met with a teenagers group, and I said, I work 20 minutes from here. I just want you to meet the kids where I work, and then we can organize an international trip. So the students came to Pontiac. They saw more than one family with 4 or 5 members each living in a single home, sometimes in only 1 bedroom, sometimes with no heating, or with broken windows, even in the Michigan winter. These young people never thought that there were people living in such difficult conditions just a few miles from them, right next door. And after that, they decided to start mentoring these kids and leave the international trip for later. The University of Minnesota has a strong commitment for global health. But as you have learned here, wherever you were working in a urban community or in rural Minnesota, our immediate responsibility is within our immediate communities. Last lesson, never stop strengthening your human competencies. The degree that you have so proudly earned today signifies that you have achieved a high level of technical and professional competencies. But impressive as they are, the real success in your careers will be measured not so much on the technical competencies, but in the human competencies that you have developed. Your empathy, your compassion, your humility, your tenacity, your courage, your generosity. These are the competencies that our world needs the most, and these are going to be the competencies that will take you far. I want to leave you with one final thought. Of course, it's about soccer. I hope we have some fans here. Who thinks that the goalkeeper is the most important player on a soccer team? Not many people, right? The goalie may be well-trained, but he or she is the last line of defense. It's the other players who make the team great, right? On a really great team, the goalie will never come into play. The same is true when we think about health. The goalkeeper is the health system, physicians and hospitals. If everybody else fails, they are there. But there are 10 more people trying to keep the ball outside the goal, That's the conditions where we live, learn, work, and play. It's our climate, our lifestyle, our food, our exercise. It's the housing, the work, and the educational opportunities. It's environment. That's all of us. That's public health turf. When I look at you, I see the most incredible team. Talented, passionate, compassionate, and I think that with you on the field, we can give the goalkeeper a break. This is a time for public health. This is our time. We have an opportunity almost to make magic in this world. And as great as our challenges are, with you on the field, I know the progress we have made in the last 75 years of this school's life will be nothing compared to what the graduates of this school will achieve in the next 75. So, class of 2019, the world is waiting for your leadership. Congratulations.
Thank you so much, Laura. You may not know it, but the Association of Schools and Programs of Public Health is extremely vital to those of us in the academic world of public health because it is the organization that brings us all together in our common goals of research, of bringing together the education of future public health scientists and professionals, and also, frankly, helps keep us up to speed on what our employers and our workforce need and want in the future. So the role that she has is one that we would not be able to be the school that we are without that assistance. So in some cases, it takes a village to raise a child. I think it also takes a village to keep a school of public health strong. Well, with that, it is my pleasure to introduce today's student speaker. This is a tradition that we have in the School of Public Health, that each year the class, in this case the class of 2019, chooses a speaker to represent them. And today, I want to introduce you to Taiwo Aremu, who is a physician and a researcher from Nigeria. He is also going to receive his Master's of Public Health degree from Public Health Administration and Policy program. And during his time at the School of Public Health, he served as a student ambassador, as a student senator, and he has been a leader in the classroom as a teaching assistant. And he has also been a community health initiative consultant. We have no doubt that he will use these skills in his public health education in the service of peace and unity and equity and justice. Please join me in welcoming School of Public Health student commencement speaker, Taiwo Aremu.
Thank you. The Chinese philosopher Lao Tzu said that a journey of 1,000 miles begins with a single step. We all took a step to be here at commencement today, and I would like to teach you how to say, take a step. Don't ever stop. in my language, Yoruba. So please, you're going to join me to say this. Gbé ìgbésẹ̀. Má ṣe dúró. One more time. Gbé ìgbésẹ̀. Má ṣe dúró. That was great. Thank you. Good evening, Dean Finnegan, our commencement speaker, Dr. Laura Magana, University of Minnesota leaders, faculty and staff of the School of Public Health, fellow colleagues, invited guests, families, and friends. I'm happy to stand before you all this evening with a piece of my mind. To God be the glory. In 1977, my dad took a giant step. He left Nigeria for the United States to get a better education. Can you imagine traveling to a land, a place where you do not know anybody, just because you want to acquire knowledge? It's not easy, right? It must have been a giant step. When my father arrived in the United States, the semester had already started at his school, and there was no housing available. The secretary to the dean at that time, Carol Hawson, a white woman from Minnesota, invited him to live with her, her husband, and her 4 children in their 3-bedroom house. I grew up hearing the story of his adopted parents. My dad stayed with the Hawson for about a year before moving on to University of Wisconsin-La Crosse. In 1983, he graduated and returned to Nigeria. 36 years later, my dad decided to take another trip to the United States, this time to see me graduate. And to see Carol once again. Please help me welcome, as I request that my dad, my mom, the Hawson, Robert and Laurie, they're present here, and my wife, rise for recognition. Thank you. Carol is back at home. She's watching us live. And so Carol was saying hi. The Hawson are clear proof of the humanity in diversity. To my parents and sponsors, dad and mom, Babantos àti Yantos, ẹ ṣeun gan o, Olúwa á bùkún fún yín. Àmín Jésù. To my best friend and wife, Tosin, thank you for always believing in me long before I took that step to be yours. Dear graduating colleagues, I grew up wanting to help people who suffer from an unfair health care system that serves mostly the rich. That led me to study medicine and surgery. Fast forward to when I became a physician about 7 years ago and was able to help one patient at a time. But I had a dream, like so many of you, to help so many more people. I found the School of Public Health, like you did, as a way of realizing that dream. To come to Minnesota, I needed to take a step. I needed to leave my job, my family and friends in Nigeria just to start a different life. A life of late-night studies, assignments, quizzes, and lots more than I could imagine. Here we are, from far and near, together in pursuit of a common goal, and that's to improve public health. With the rising trend of new diseases and disasters, the world looks up to us for solution. And as public health leaders, we must help. So to find those solutions, we need good ideas. Good ideas. But if we live here with our bright ideas and never work with others to make them a reality, they will remain what they will always be, and that is good ideas. All right, what then can we do? We need to reach out, make connections, and collaborate. Fellow graduates, it does not matter who you are, what you look like, or the belief you have. We are one. We are public health leaders. The person sitting next to you is human like you, so reach out. When I arrived in the United States, I realized I needed to reach out and find a mentor. I looked at the faculty at my new school, and I found one. I took a step and connected with Professor James Began. As you can see, he does not look like me. We have different backgrounds. His beliefs are different from mine. Yet, we were willing to find the middle ground. He is a professor, no doubt. Yet, we share opinions on important issues, and he was instrumental to my first teaching assistant position. Thank you, Dr. Began. Let me emphasize, reach out. Take a step. Don't ever stop. Gbé ìgbésẹ̀, má ṣe dúró. There are endless possibilities when we work together toward a common goal. President Abraham Lincoln rightly said, "Our stories may be singular, but our destiny is shared." Because time is fleeting, take a step today. Get the contact information of your colleagues and other professionals moving forward. Make an active effort to share ideas. Those who stand still run the risk of being overlooked and forgotten. You want to be remembered? You want to make the world a better place? Yeah? Then take a step and don't ever stop. Gbé ìgbésẹ̀, má ṣe dúró. Class of 2019, you're going to join me one more time to say that. Gbé ìgbésẹ̀. Thank you and congratulations, class of 2019.
And now you're going to take that one more step. The time has come. Today is a significant milestone in the lives of all of you, and Lord knows your families too. Graduates, rather than marking an ending point, commencement, the word denotes and signals the beginning of the next stage in your life, and it's a time when you take all that you've learned in this classroom and in the field and what you've learned from your professors and your classmates and from one another, and you transform that new knowledge into practice as public health professionals. Now we move to that stage, and I am going to invite Professor Diane Newmark-Steiner to the podium to present this year's candidates for degrees from the School of Public Health. And I'm going to ask Regent Beeson and Karen Wick to join me in greeting the graduates. And so, Diane, it's now your turn to introduce this year's graduating class.
Thank you, Dean Finnegan. Before I begin, as a professor, I want to congratulate all of the graduates on all your hard work. And as a mother, I want to congratulate all of the families here. I know it's a very emotional moment, so congratulations to all of you. We're going to begin with the Masters of Healthcare Administration. Hannah Anderson. Keegan Atack. Shivani Rao. Paige Danielson. Olivia Dybert. Jonathan DeYoung. Stephen Holland. Johnny Holmgren. Tanner Hunt. Brandon Janicki. Andrew Jensen. Rachel Coonley. Chanel Laylor. Travis Marker. Alexis Meyer. Biula Momanyi. Curtis Norman. Riley Orell. Will Ramsey. Andrew Richards. Tori Robinette. Samantha Shipley. Antoinette Shockey. Just going to wait a minute. Henry Soderberg. Lauren St. George Schrader. Lisa Zanakis. Anna Wilden. Audrey Workman. Jay Zachman. Subin Askari. Kathy Good. Courtney Herring. Andrina Huffin. Lisa Johnson. Shalisha Lee. Amy Lefebvre. Catherine Lemke. Kayla Lemke. Beth Ann Olson. Mariam Shafiq. Amy Stegner. Lori Wukowitz. And now, it is my honor to introduce our Masters in Public Health students specializing in community health promotion. Kelly Arstead. Cameron Bright. Yasmin Cespedes. Jinhee Cha. Barite Dawood. Carolina de la Rosa Mateo. Sarah Dornick. Sarah Dufour. Catherine Fueling Porter. Teresa Fouch. Paul Galshut. Kaher. Lauren Hinckley. Cecily Hoyt. Leah Jesser. Camille Kraljic. Haley McCarran. Julia Newmelin. Deborah Schnorr. Daniel Schremer. Carl Schwinghammer. Tiffany Trin. Morgan Wright. Jenna Yackel. And now it is my honor to present the Masters in Public Health Environmental Health students, beginning with Zamzam Abdirahman. Bharat Balyan. Natalie Bontrager. Sarah Danelius. Kelly DeWeese. Yuko Ekialungo. Hannah Evanson. Nicholas Fortmeyer. Catherine Marie Bass Haugen. Otis Hyman. Monique Kolb. Peter Mitchell. Natalia Nice. Sierra Palmer. Grace Pankratz. Madeline Schenk. Anthony Parker. James Seifert. Eric Svingen. Hannah Young. And now it is my joy to present the Masters of Public Health students in epidemiology. Angelia Anderson. Linnea Baird. Hannah Chakoyan. Melise Chasse. Aaron Clark. Megan Carreri. Paige DeHealy. Victoria Dow. Charles Genther. Anne Hakey. Rachel Holstein. Paxton Huberty. Devon Hunter Schlichting. Samuel Jacobs. Gretchen Johnson. Natasha Kataiva. Nathan Kemp. Elizabeth Langford. Alexa Martin. Inari Mohammed. Eula Muga. Eric Nehans. Ashley Oglesby. Jada Palmer. Thomas Rooney. Jennifer Smith. Siley Tambe. Rina Yarosh. And now it is my pleasure to introduce the Maternal and Child Health Masters in Public Health graduates. Jesse Austin. Megan Coleman. Abigail Covington. Allison Danish. Amber Davidson. Affie Dagbay. Kai Erickson. Jeanette Fernandez Baca. Jason Foss. Caitlin Cavanaugh Grow. Audrey Hansen. Sarah Horton. Chelsea Klein. Leslie Coomer. Emily Larson. Hannah McNamee. Shelby Pantea. Keelan Roche. Catherine Spray. Elizabeth Sanchik. Cara Alman. Brianne Warren. Tiffany Yang. Yeshareg Yisma. And now, I get to introduce the Public Health Administration and Policy MPH graduates. Adam Austin. Congratulations. Ibiwumi Atolagba. Margaret Byrne. Cassandra Canaday. Yasmin Chowdhury. Camille Cleveland. Anne Conmey. Sina Golzarian. Maya Greifer. Natalie Ha. Amelia Haryu. Taiwo Oremo. Catherine Jacobson. Tunia Kang. Erica Lara Ovares. Annie Lee. Skylar Martinez. Frederick Oguwa. Madeline Pick. Ankita Rajpurohit. Summer Robbins. Lauren Rowan Cole. Kellen Shelter. Trishna Sharma. Sana Siddiqui. Lauren Solheid. You all do. Shivani Thacker. Nels Thompson. Mariana Story Tuttle. Timothy Ussett. Crystal Wabnam. Rashad Waziri. Jingyu Wu. Zhang Zhongjai. Sabrina Zimmerman. Yes. And now, it's my honor to introduce our Public Health Administration and Policy Executive Program Masters in Public Health students. Jamie Arthur. Susan Grafstrom. Darlene Grossman. Catherine King Scribbins. Daisy Musa. Heather Ogren. Kathleen Ronke. Brian Shu. Christy Wentworth. And now we get to introduce the Masters in Public Health Nutrition students. Starting with Yetunde Akingbemi. Kirsten Arm. Congratulations. Kelsey Bigby. Congratulations. Melanie Bortel. Christine McIntyre. Kelly Olzenak. Caitlin Piers. Allison Rudnikas. Sarah Studley. Kalia Thor. Noel Yo. And now I'm going to introduce the Public Health Practice Masters in Public Health students. Lynn Bata. Bridget Fisher. Catherine Keys. Maddie Klusner. Fitz Nuntalar. Danielle Pachuli. Francisco Martinez Rodriguez. Julia Urban. And now we have our Masters of Science students, and we're going to begin with Sana Khan. Yun Sun An. Jing Bai. Ella Shrenka. She Yu Gong. Meredith Heyan. Cheng Li. Yichen Q. Si Young Ren. Shruti Vempati. Chu Yu Young. Ye Ting Wang. Sheng Wei Zhang. Congratulations. Ting Young Zhou. Magdalena? Magdalena Osario. Her Shi. Lindsay Drew. Sutton Dawans. Shannon Martin. Dimpo Oriozi. And now we are going to move to the Doctor of Philosophy students, greatest honor in the School of Public Health. Right. Just whoever comes up. We're going to begin with Elizabeth Goldsmith, who is receiving her PhD in epidemiology, and she will be hooded by Rich McLahouse. Mary Rooney is receiving her PhD in epidemiology, and she will be hooded by Pam Lutzy. Congratulations, so exciting. Alan Tate is receiving his PhD in epidemiology, and he will be hooded by Michael Oakes. Lesley Weaver is receiving her PhD in Health Services Research, Policy, and Administration, and she will be hooded by her advisor, Todd Rockwood. Liana Weisblum is receiving her PhD in Health Services Research, Policy, and Administration, and she will be hooded by her advisors, Peter Huckfeld and John Christensen. Gotta get it right for your PhD. Congratulations. Gianni Yu is receiving her PhD in Health Services Research, Policy, and Administration, and she will be hooded by her advisors Jean Abraham and Peter Huckfeld. Hitakshi Sehgal will be receiving her PhD in Environmental Health, and she will be hooded by her advisors, William Toscano and Elizabeth Wattenberg. Ishrat Kamal Ahmed is receiving her PhD in Environmental Health, Infectious Disease, and she will be hooded by her advisor, Michael Osterholm. Hannah Volkman will be receiving her PhD in Environmental Health, Infectious Disease, and she will be hooded by her advisor, Claudia Munoz Zanzi. So exciting. It's your family here. Tiana Bastian is receiving her PhD in epidemiology, and she will be hooded by her advisor, Eileen Harwood. Christopher Campbell is receiving his PhD in epidemiology, and he will be hooded by Alan Lifson. Kirsten George is receiving her PhD in epidemiology, and she will be hooded by Erin Folsom. All the kids are screaming for you. Brian Hart is receiving his PhD in biostatistics, and he will be hooded by Mark Fiakas. Jinjin is receiving her PhD in biostatistics, and she will be hooded by Joseph Koopmeiners and Lin Zheng. Jinsheng Zhou is receiving her PhD in biostatistics, and she will be hooded by Hai Tao Chu. Shannon Sullivan-Segan is receiving her PhD in Environmental Health, and she will be hooded by Irina Stepanov. Michelle Meyer is receiving her PhD in Environmental Health, and she will be hooded by Cred Hedberg. I just want to say this is so much work to do a PhD, both for the student and the advisor, so just really a huge congratulations to all of these. Not done yet. And our last PhD candidate, Scott Vial, is receiving his PhD in Environmental Health, and he will be hooded by Cred Hedberg. So with that, I just want to offer my hearty, hearty congratulations to the class of 2019. I think we're going to get to do that again anyway. I now have the privilege of introducing Dr. Kristen Anderson, Professor and Associate Dean, to introduce the Public Health Professionals Pledge.
Good evening, and congratulations again. One of our most treasured commencement traditions is the recitation of the Public Health Professionals Pledge. This statement affirms our shared goal in trying to improve the health of populations, and it unites us as a profession. You can find the pledge on page 28 of your program. It's the last page. As part of the tradition also, we ask the incoming president of the School of Public Health Student Association to lead the graduates in the pledge. This year, that's Zachary Mayno. Zach is a master's student in epidemiology. Zach, if you are... Oh, there you go. Voila! Thank you.
Graduates of the class of 2019, it is an honor to lead you in the pledge. Please stand and repeat after me. As a public health professional, dedicated to enhancing the health status and well-being of individuals and communities, I pledge to hold the public interest and health of populations as my high professional goals.
Graduates, please be seated.
Graduates, you are soon to be official alumni of the School of Public Health. And our alumni family now includes nearly 12,000 living alums and stretches around the globe. SPH alumni have become national health ministers, hospital CEOs, state epidemiologists, and leaders within the World Health Organization. You join a distinguished group of people who share the commitment to make the world a healthier place. And we here have no doubt that you too will make your mark. Here to deliver a message of welcome is Karen Wick, President of the School of Public Health Alumni Society Board. Karen received her Master of Public Health degree in Environmental Health in 1994, and she has 35 years of experience in the medical research field and in clinical research development. Her public health passion is the opioid epidemic, and in her tenure as Alumni Society Board President, she has asked her fellow board members to focus their efforts on tackling this public health crisis. Please help me welcome Karen Wick.
Thank you, Dean Finnegan. Congratulations, class of 2019. I am honored and privileged to be welcoming you to the School of Public Health Alumni Society. While formally founded in 1944, the first degrees and certificates in public health were awarded by the U in 1935. That's a lot of alumni. These individuals span the state, country, and the globe. We are a strong network of leaders committed to public health and to improving the health and well-being of people around the world. As a graduate of the school, each of you now belong to the School of Public Health Alumni Society. There's no need to sign up or fill out a form. You're automatically enrolled in one of us. I strongly suggest you connect with this amazing network. You can become a mentor, join our alumni board, and contribute to the academic experience for students who follow in your footsteps. You can attend events, make donations to support scholarships, or become a preceptor. Opportunities to give back abound. And here's what we promise you. The more you put into the Alumni Society, the more you'll get from it. Just like in your student experience, the more you engage and the more you invest in building relationships, the more you will benefit from our strong and engaged alumni network. The Alumni Society offers you a network of colleagues and mentors as you navigate your career and as you grow professionally. There are opportunities for leadership development through our volunteer committees and board. And you can even explore public health around the world through our travel program. Perhaps most importantly, we help you stay connected to this day, these people, and the passion for public health that helped you make it through grad school. So one more time, let me say congratulations to the class of 2019 and welcome. I am proud to call you a colleague, a peer, and in just a few more minutes, a fellow alum of the School of Public Health.
Next, I would like to introduce the University Board of Regents member Richard Beeson to confer your degrees. Regent Beeson, as Dean of the School of Public Health, it is my pleasure to present to you the 2019 graduates of the School of Public Health. Graduates, please rise. Welcome, Regent Beeson.
Thank you, Dean Finnegan. It's incredibly inspiring to be here today, and on behalf of the University's Board of Regents, I extend heartfelt congratulations to the class of 2019, and I'm excited to see the impact that you'll have on the future of health in this country and around the world. Thank you, Dean Finnegan, for inviting me again to be part of this momentous occasion for the School of Public Health and its graduates today. So shall we make this official? I think we will. Upon the recommendation of the faculty and by authority of the Board of Regents of the University of Minnesota, I now confer upon you the degrees for which you've qualified. Congratulations.
I can hear the applause from the other side of the world as well, coming right over the internet. Everybody in this room is glad about this and glad that you will be part of that next generation of leaders. We want to offer, as you can tell, our heartfelt congratulations to the class of 2019, and we are going to ask our guests to please remain seated until our faculty and our graduates have exited. And after the recessional, we invite you to meet your graduate in the lobby out there for a reception. And before we leave, you must rise and join us in the singing of the Minnesota Rouser, which is printed on the final page of your program. Thank you all, and have a fabulous evening.